Hello friends, in this video we are going to see the remaining important questions of pediatric nursing. The first question is define bronchial asthma, list the causes, explain the pathophysiology of bronchial asthma, and C. Write the medical and nursing management of bronchial asthma. First we will discuss about bronchial asthma. Asthma is a chronic inflammatory disease of the airways that causes the airway hyperresponsiveness, mucosal edema, and increases the mucus production. So this is a definition of asthma. The second definition is asthma is characterized by chronic airway inflammation and increased airway hyperresponsiveness, leading to the symptoms of wheeze, cough, chest tightness, and dyspnea. Now we'll see the etiology of asthma. Asthma can be caused by host factors like can be because of genetic predisposition, means because of genes there's a chance of airways becoming hyperresponsiveness. It is also seen more common in male babies. Next is environmental factors like allergens, indoor allergens like domestic mites, furred animals, cockroach, allergens, fungi, molds, and yeast, and outdoor allergens like pollens, fungi, yeast. And it may be because of infections like viral infections predominantly occurring in 40% of children. Can also be because of seasonal variations. So seasonal variations, you can see the asthma attacks are more commonly experienced in children by about 35%. And diet like certain foods like those children who are allergic to peanuts, eggs, and wheat can also produce asthmatic symptoms. Next, sensitization to allergens and certain pollutants like tobacco smoke, mosquito coil smoke, sprays, perfumes, and it can also be because of respiratory infections, psychosocial factors, and drugs like aspirin and beta blockers. So if you see the pathophysiology of asthma, because of any of the causes like asthmatic triggers, results in the inflammation and edema of the mucous membrane. So whenever the inflammation occurs and the mucous membrane gets inflamed, always the mucus secretion starts increases, and also it causes the spasm of the smooth muscles of bronchi and bronchioles, and this decreases the calibers of the bronchioles. Whenever the caliber of the bronchioles is diminished, what happens is it reacts easily to the this allergens, and it causes the narrowing of the bronchioles, resulting in the symptoms of wheeze and difficulty in breathing. The clinical manifestations are more commonly it causes dyspnea, wheezing, and cough. And also you can see the episodes of asthma usually begins with the child. They start feeling irritable, and also they become more restless. You can also see more nocturnal cough, that is breathe at the night time, and they become breathless. And asthmatic child may also complain of headache, feeling tired, and chest tightness. Diagnostic evaluation is history taking. We commonly ask about the recurrent episodes of wheezing, and whether the parents can hear any high pitched whistling sounds when the baby is breathing, and whether the child is having any troublesome cough, especially which is worsening at night or on waking up, or if the child is awakened during the night by cough, or by experiencing any difficulty in breathing in night times. And does the child have cough or wheeze after any physical activities like playing games and exercises, or when the children are excessively crying, also this asthma trigger starts. The airways becomes hyper responsive to all these emotions also. And also we need to ask about whether the child is experiencing breathing problems during a particular season. So these are the common history taking, that is you will ask to the parents generally these questions. Next, a physical examination, you need to look for dyspnea, expiratory wheeze, and also whether the child is using accessory muscles for breathing, and also whether the child is having any difficulty in feeding, talking, and getting to sleep easily, and irritability to cough, and eczema and allergic rhinitis. So you need to look for the signs and symptoms of all these things. And the next other important diagnostic evaluation is chest x-ray, where in the x-ray we are going to see whether the airways are become narrowed, or whether there is any inflammatory changes that has occurred in the bronchioles. So chest x-ray, usually it is not needed, because with the signs and symptoms only we can identify, but sometimes when the signs and symptoms we cannot predict it with the signs and symptoms, we need to go for the chest x-ray. The next comes the medical management as oxygen. We need to give oxygen to keep up the oxygen saturation to the level of 95 percentage, and especially for the children who are sinus and also who is having difficulty in breathing, and this difficulty in breathing is interfering with the talking, eating, and breastfeeding. We need to go for administration of oxygen. Next, pharmacotherapy, like we need to give a quick relievers to get rid of this acute asthmatic attacks. So especially bronchospasm can be relieved with the help of this following drugs like salbutamol, terbutaline, adrenaline, aminophylline. So, and also that we need to control the inflammation and further attacks, we need to take certain preventers like steroids, which is usually given in the form of oral, and inhaled steroids is given in like theophylline. And there are also certain drugs which need to be taken during for long term symptoms relievers. They are called as, so usually the categories of this are salmeterol, formoterol, and bambetrol. So always this all comes under the inhaled steroids. So the nursing management for asthma is we need to provide education regarding the triggers of asthma, and also we need to ask the parents to have some environmental controls like keeping the child away from the dust, the mites, and also the animals fur. We need to control all these things, and we need to evaluate for whether the medicines whatever is giving is being working or not, and also provide emotional support to the parents and the family, and regular follow-up is necessary. These are the general things that comes under the nursing management. Next, we need to give certain education to the parents, that is about the disease, and also about the sexual bias. And also here we need to tell that this disease is a non-communicability disease, which will not spread from one person to another person, and fear of use of inhalers and steroids should be taken away from the mind of parents. And we need to give certain environmental control, which I already told you, control of dust mites, and also we need to control the cockroaches, where we are going to cover the garbages and unused food containers. And fungus, we need to keep the walls always dry and have good ventilation at home, and clean the showers and curtains weekly. The next point is pets should be kept away from the sleeping area if possible outside the house, and avoid strong odors like smoke, mosquito coil burning, and especially tobacco smoke. So these things should be controlled under the environment. Next, the continuation of this nursing management, under that we have seen the first point is education, and second point was environmental control, and third point is evaluating respiratory status and patient's general condition. So here we need to frequently assess for the respiratory pattern, and look for any cyanosis, look for any adventitious breath sounds like abnormal breath sounds, vital signs to be monitored frequently, and see the cerebral function. Next is we need to provide an emotional support. Try to keep the child always calm and quiet, and have a trusting relationship with both the parents and the child. develop a trusting relationship, and reassurance is most important. Provide play and recreation therapy for child, because they'll always be under the stress of disease process, and also the hospitalization, and also always allow the child parents to take participate in the child's care. And next is positioning. Always provide comfortable sitting position with the supporting pillows, and leaning forward may be allowed if necessary. And also we need to administer oxygen based on the doctor's order. Administering fluid therapy. Why it is necessary? Because during asthma they may take less amount of fluid, resulting in a loss of fluid from, and also there is a loss of fluid due to hyperventilation, and we need to continuously monitor intake and output chart, and also maintain adequate dietary intake, so with the help of clear liquids in small amounts, but allergic foods to be avoided, spicy and gas forming foods to be avoided, and balanced diet should be taken. Next is maintain hygienic measures, like routine hygiene care can be provided, dust and allergen free environment, aseptic techniques, supporting parents and family. In that you need to provide emotional support, allow the parents to take part in the child care, and discuss the treatment plan with them so that they will be away from the stress. Also provide health education on the child's condition, and also the about the disease process. The second question is define cleft lip and palate, and discuss the pre and post operative nursing care. Also, care of child who have undergone the surgical repair of cleft lip. So, we'll see the answers now. So, the definition of cleft lip and cleft palate goes like this. It is a congenital malformation resulting from failure of fusion of maxillary process during the intrauterine development, and this defect may also occur alone or altogether. Means cleft lip may occur alone or sometimes combined with the cleft palate, or cleft palate can occur alone or combined with the cleft lip. So it is usually a congenital disorder starting from the intrauterine life itself. We'll see the definition of cleft lip. Cleft lip is a failure of fusion of maxillary process with the nose elevation on a frontal prominence. Types are partial, incomplete, complete, unilateral, and bilateral. I'll show you what it is. As you can see in this picture, the first one is unilateral, but it is incomplete. What does incomplete means? As you can see here, the failure of fusion is only to the partial amount and not reaching till the notch of the nose. But here you can see incomplete, you can see it is reached till the notch of the nose. So this is one-sided, that is why it is called as unilateral complete. But it is not reaching to the nose, and it is called as unilaterally incomplete. And yeah, bilateral complete is it is reaching to the notch of the nose and it is on present on both sides. That is why it is called as bilateral complete. Next type is incomplete cleft palate. You can see the palate also not completely coming till the lips and the nose. It's only a little amount only involving the palate, and that is what is called as incomplete. And this is unilateral complete lip and palate involving both the lips, palate. This is bilateral complete lip and palate, where you can see involving this both the sides, lip and palate together. That is what is called as bilateral complete lip and palate. Now we'll see the definition of cleft palate. Cleft palate is a failure of fusion of hard palate with each other. That means the hard palate has to fuse with the soft palate, but it is not happening here. And sometimes the cleft lip and palate can occur togetherly. Already I told you about this. So types I already explained, that is complete, incomplete, unilateral, bilateral. I told you the meaning of what is complete and incomplete, right? So if you see the etiology, it usually occurs, cleft lip occurs 1 in 750 birds, and cleft palate occurs 1 in 2500 birds. And cleft lip is predominantly seen in males and cleft palate is seen in females. Causes are like medications, certain medications taken by the mother during the time of pregnancy, um, that is uh, that is anticonvulsant drugs, chemotherapeutic drugs, methotrexate and Achen medicines, and exposure to viruses, chemicals, exposure to X-ray. This all during the time of pregnancies, and maternal conditions like anemia, hypoproteinemia, maternal alcohol abuse, and maternal smoking. Next, we'll see a quick review of pathophysiology. So during the embryological development, what should happen is the lower lip and the nose should fuse together to form the 5 major facial prominences. But what happens here in the cleft lip and palate is this nasal prominences, facial prominences fails to fuse together. That is, it is resulting because of failure of fusion of maxillary and, you can see here. So what happens is the lip development occurs during the 3rd and the 7th week, and the palate development occurs during the 5th and the 12th week. So what happens in cleft lip and palate is, it is because of the failure of fusion of the maxillary and the premaxillary process, resulting in failure of the palatal process fusion, and it can cause complete or partial non-union, which can affect the palatal bone along with the upper lip, maxilla, premaxilla, and the tissues of soft palate, and uvula also is sometimes involved. We'll see the complications of this cleft lip and palate. Usually it is associated with the feeding problems, respiratory problems, and also ear infections and and you can also see speech problems and dental problems commonly occurring in children. These are the complications arising due to cleft lip and palate. So diagnostic evaluation, as I already told you, this can be identified in the prenatal period itself because it's a congenital malformation beginning in the intrauterine life. We can confirm the disease condition with the help of maternal ultrasound and also after birth during immediate physical examination. Sometimes when the cleft palate is incomplete, not involving both the palates and the lip, it is difficult to identify from the outside appearance. So what we should do is we should put a gloved finger inside the mouth to feel the defect or visually examine the defect with the flashlight to confirm the diagnosis. A surgical management is it requires 1 or 2 surgeries to correct this defect. So initial surgery is usually done at the age of 3 months. The name of surgery is Tennyson-Randall triangular flap surgery, also called as Z-plasty or Millard's rotational advancement technique. So you can see after the surgical repair how the defect appears. Usually the suturing is done in a Z-shaped manner because it allows the easy healing of this defect. Easy healing of the defect can be done with the Z-plasty, means the suturing is done in the Z shape because it allows for the easy healing and also prevents the frequent rupture of this sutures. So this is most commonly used surgical sutures. And cleft palate, it requires multiple surgeries. Multiple surgeries is required. The first surgery is usually done at the age of 6 to 12 months to make the proper development of the teeth and the facial bones. Also, you can see the second surgery is done at the age of 8 years, where it involves bone grafting to fill the upper gum line and also to support the permanent teeth and to stabilize the upper jaw. Nursing management usually involves has to immediately detect the defect immediately after the birth, and also we should avoid complications like by feeding. What will happen, sometimes chances of aspirations are more for them, and also we should always convince the parents, because always they'll be in some shock and negative reaction because by seeing the appearance of the child, and also because of the inability of the child to suck, there's a specialized devices are available to feed these babies, and breastfeeding is possible with the use of palatal prosthesis. So you can see here You can see here the palatal processes are also called as palatal obturator can be used to feed these children who are unable to suck, and sometimes we can ask the mother to express the breast milk, and which can be given with the help of syringe with a specialized rubber tube, and always have a long handle spoon and dropper or soft nipple with a large hole to allow us and to facilitate the feeding. So you can see in this image how the baby is hold is held in the mother's breast to help in promoting feeding, and also what is the correct angle to hold the baby while feeding, and also the type of nipples used for feeding these babies and the type of spoons. So we'll see the nursing management of care of baby before surgery. Basically, we provide all the pre-operative care that is required. Like we need to take the consent from the parents and do all the investigations. And also, the baby should be kept for nil per oral for at least 6 hours prior to the surgery. Care of baby after surgery. Immediately after surgery, we need to observe for the vital signs. And always observe for the site of surgery for bleeding, and turn the baby's to face to one side, which will facilitate the drainage of secretions and prevents aspiration. Also protect the surgical site from injury and position the baby on backside. Arm and elbow restraints should be provided to prevent the child from touching the suture, and restraints to be removed periodically, and we can always use this Longan's bow to protect the suture area. So this one. So thank you friends for listening to my video, and if any doubts please leave it in the comment box, and if you like this video please do like, share and comment. Thank you. Meet you in the next video.